Dear colleagues, my name is Kizyma. Today I will present about caring for pediatric cancer patients during the war in Ukraine caused by Russian military aggression. Thank you for the possibility to speak at ASTRO23. I have no conflict of interest to disclose. Here I represent the Ukrainian Professional Society of Pediatric Oncology Hematology, founded by 3 major pediatric cancer hospitals in Ukraine. Our professional society has the vision that successful treatment of every child with cancer is possible in Ukraine. Before the start of the war, we had more than 100 active members from 16 centers across the country. Here I also represent the hospital that I lead as the CEO, the Western Ukrainian Specialized Pediatric Medical Center. It is one of the biggest PHO centers in the western part of Ukraine and in Central Europe. We provide a full cycle of treatment for severe pediatric diseases, and our center treats more than 100 children with cancer at one time at our inpatient facilities. For the start of the war at 2021, we have performed a huge analysis where we calculated that Ukraine had more than 30 PHO centers across the country, serving for more than 100 new annual cases of pediatric cancer. This has drastically changed after the attacks by Russia, and here you can see that there are cities in the east that are still under attack in 2023, and we had the capital Kiev and southern cities like Odessa and Mykolaiv, Kherson attacked by Russia in 2022. This has caused an unprecedented international evacuation of PHO patients by so-called Safe for Ukraine project. More than 1,500 patients were evacuated to different countries by this project, and 50 convoys from our center to Poland with 500 patients and more than 1,400 their family members were moved in so-called medical evacs to save these kids and their families from the war. At the same time, more than 300 PHO patients on active treatment were in our center, which is a 100% increase compared to the previous year. The reasons for evacuation were the physical unsafety of patients, the treatment disruptions, the interruption of all the supplies, the failure of infrastructure, electricity, internet, hospital damages, the logistic disruptions, the lack of multidisciplinary healthcare personnel in the cities under attack, and of course the limited funding. 18 countries accepted more than 1,500 Ukrainian children with cancer for treatment. Some of them were paid very big attention even by the first persons of that countries, and we thank all these people from all these countries for helping our children in this situation. Pediatric radiotherapy is still performed in Kiev and Lviv with linear accelerators and dedicated teams. We try not to send children to the other cities where we have no dedicated pediatric team because of the low quality, and we try to concentrate this in the centers of excellence. For the selected cases who need proton therapy, the Safe for Ukraine provides the special mechanism of referral to 4 countries in Europe that provide these services. These are Polish centers, German centers, Netherlands, and Switzerland. The median time of referral is 10 days, the maximal is 17 days. At our center, we have the evacuation line. We meet patients at railway stations, accommodate them in our city, escort them in convoys. We coordinate the patients between doctors, support them at the hub in Poland, and escort to the airports in Poland to send them to different places. At the same time, there is a treatment line. We still treat patients in Lviv, so we divide our team into evacuation and treatment lines. We rotate the teams. We spend a lot of time to receive humanitarian aid with medicines from Poland, Germany, Italy, and even distant countries like USA and Canada. Also, we provide the support to nurses which work enormously. The current challenges for Ukrainian PHO care is the uncertainty. We don't know whether should we proceed with evacuation or restore the treatment in Ukraine. We observe some Ukraine fatigue or war fatigue in the international community. We try to retain the capacities of the hospitals and PHO providers in their professions. The current needs and plans for PHO community are the training opportunities for medical personnel abroad. They travel with their patients sometimes and provide the best care they can for the patients in need in different countries, translating, communicating, and providing the coordination. We also try to use the resources in Ukraine wisely. So we developed the reference centers that will accumulate all the possible resources into a couple of hospitals. This will make the team development, capacity building, and patient referral pathways more effective. At the same time, we wow for international collaboration with St. Jude Global Alliance, Global Initiative for Childhood Cancer, SIOP and SIOP Europe, and of course, all the possible organizations such as ASTRO. Thank you for the possibility to present this information, and thank you for doing all you can to support Ukrainian doctors and patients in need.